Uh-huh. Wonderful. Now it's perfect. Now it's perfect. Wonderful. Good morning. Good. I start again. Good morning. Good afternoon. Good evening. Here from Moscow. And I would like to welcome everybody to our fourth day of marathon of the Regions for Health Network. And the objective of today is to summarize what has been discussed in the 3 days before and to discuss, but also to understand from our partners on what are their priorities and how can we best collaborate united for health. I would like now to introduce my co-chair, Eugenia Semutnikova, whom you have been meeting over these 3 days. Eugenia, the floor is yours.
Good afternoon, dear colleagues. It is our fourth day of work of our 26th meeting of the Regions for Health Network, and I'm happy to welcome you on behalf of the Moscow government and on behalf of the Department of Nature Management and Environmental Protection of Moscow. Today, we have a challenging task of summing up the 4 days of our meeting, and we will also speak about our ideas and proposals regarding how we can organize our work in future from the point of view of the organization and of content, so that our work is efficient and could bring specific results. Happy to welcome you.
Eugenia, thanks so much. Now, I would like to give first then all the floor to Leda Nehmer, who is WHO consultant, and Leda has been so kind to summarize or to summarize the first 3 days. Leda, the floor is yours.
Thank you very much, Bettina. Thank you very much, Eugenia. Good afternoon, ladies and gentlemen, dear participants, gracious Russian hosts. I'm a WHO consultant working with the Healthy Settings program based in Venice, Italy. Many of you I know through past work we have done together, documenting your experiences. Others I look forward to meeting one day in person. I've been given the task of summarizing the past 3 days, which is not easy. It's like having a big cake and not knowing what piece to cut off, since each is equally inviting. Before putting together my speech, I consulted with a few people, the team I work with in Venice, and with our dear rapporteur, Mr. Chris Riley, who will be producing the meeting report, which you will see after the meeting. Over the past few days, it's been a privilege to have had the opportunity to meet again, a year and a half after our world has been turned upside down. We have shared our experiences dealing with COVID at regional level, cross-border approaches. We've heard about the reform of primary healthcare systems, Moscow city responses, the importance of intersectoral collaboration for health, and the involvement of all departments working in the areas of health, environment, social protection, and transport. Longer-term priorities such as health equity and worsening, and how inequity has worsened people's situations with the pandemic. We have also acquired new knowledge and heard about new scientific evidence for climate change on early warning systems, proactive involvement of regions. We've learned about health inequities and how these are growing, as I previously said, and food systems, the environment, urban settings, and climate action, which is necessary. This is just to name a few. We've also heard about what is out there to help us. Many things are out there. The European Program of Work and its flagships, digital health, healthier behaviors, mental health, immunizations, the importance of primary health care strengthening and community involvement, the European Framework for Action on Mental Health, 2021-2025, and One Health, which highlights multi-sectoral responses and interconnected drivers to better understand and better prevent health threats. So let's go back to the key question asked to all of us at the beginning of this meeting and even before the meeting. Which are the lessons learned and what could be continued, strengthened, and taken forward in the future. Some of what we learned is familiar. Speaking with Chris Riley, he called them the P's. It's partnership, public health, professionals, and so on. But first, I would like to focus on things that are very different, though, like the 7 C's I will describe. And now I would like to share my screen with you and the presentation as well. Can everybody see it?
Not yet. Not yet.
Okay. Now?
Yes. Yes.
Okay.
Yes. Yes.
So these are the 7 C's. Let me start with the first one. COVID-19. New, frightening, unpredictable, capable of turning our world upside down over the past year and a half. But luckily, and little by little, we see it's controllable. Climate change, not new, gaining momentum, urgent, and luckily evidence-based. And we have seen many examples of what regions are doing to address climate change and international initiatives going on, such as the C40, which we heard about yesterday. We have also been reminded of the urgency of acting not within a 5-year outlook, but with a today outlook. 3, crossovers. Over the past few days, we have heard a lot about interactions between COVID and climate change. The new double challenge they have created, how they've disrupted normal business, but also, ironically, provided opportunities for accelerated change, innovation, and thinking out of the box. Which brings me to the 4th C, co-benefits. COVID has changed behaviors. People traveling differently, working differently. We would not ever have conceived of a hybrid meeting 5 years ago. And building back opens opportunities, which I mentioned before. Number 5, communication. In the sessions on communication, we heard about the importance of building trust, targeting, and how we should look to behavioral science to understand how people behave, why, and how to target different groups. And we also learned about risk communication and community engagement, a tool that regions and countries could use to produce communication strategies. 6, capacity. We heard of the importance of strengthening leadership and governance, and how this is key to future pandemic planning and preparedness. And agile leadership and the benefits that can come with trying this out. And last but not least, creativity, which is a funny word to hear in public health, but it has been key in helping us to make it in this period. In all the examples we have heard over the past few days, regions have shared with us what they have done in the face of adversity and shortages, quick changes made, and so on. Creativity has come alive in this period, and we need to hold on to this. And there are some new aspects to the previously mentioned P's. Primary health care. This is as central as ever, but the changes it has had to make may mark it forever. Communities need to be able to access primary health care easily. Civil society needs to be involved in any kind of primary health care reform. Psychosocial issues. Isolation and disruption caused by COVID with anxiety over climate change, such as extreme weather events during COVID, are happening more and more. Public engagement has never been more important. Regions are dealing with issues such as vaccine hesitancy and opposition to lockdowns. We need to learn how to work with the public on difficult climate change trade-offs. The COVID pandemic has highlighted how vulnerable we are and yet how connected we are. If the health sector does not reduce its emissions, then it is failing in its mission to help people. And finally, planning and preparedness. The world might have initially failed to some degree on COVID and had to act quickly, but we cannot afford to fail on climate change. And health systems can play their part in this too, with a strong commitment to net zero while addressing pandemic management and decarbonization. So, how do we move forward as a network with this enormous basket of knowledge and experience we have filled over the past few days? Today we will learn more from our partners. And with this, I give back the floor to the chairs. Thank you very much for your attention.
Thanks very much, Leda. Now, we have a moment of time, actually, to have some reflections on what Leda prepared, some critical issues you would like to ask, and if there are issues we completely missed out in this summary. And now, you should all be connected today. You should be all able to speak, or if not everybody, at least most of us should be able to speak today. So I would like to open the floor a moment for a bit of discussion and feedback on what Leda has been presenting. So I see. Okay, wrong window shared. We have 46 participants. Is there anybody who would like to take the floor or would like make a comment on issues we completely missed? We're getting questions. Okay, Eugenia, would you like to?
Уважаемые спикеры,
Dear speakers,
небольшие пояснения по участию. Если вы хотите
some little explanations regarding participation. If you want to speak out, please raise your hand in Zoom. If you want to ask a question or make a comment in an oral form, so please raise your hand. As soon as you do that, you will be able to speak out as a speaker. Bettina, I'm going to closely follow the messages in the chat and respond to them.
Super. So, and attendees, please raise your hand, and we will be transferring you into the panelists' talking points list. I think there was somebody who did raise the hand. No? Inge? Yeah?
Yes.
Yeah? Please.
I just wanted to say that this was an excellent presentation, and with these 7 C's and 5 P's, it's very easy to remember it, and I think I just wanted to congratulate for this, because it's very, very good and educative and easy to remember.
This is very nice of you, Inge, and so congratulations to Leda for this.
Yes.
Virginia is no comment? Okay. Okay. No hand up. No other hand up.
We have a question from Odile Maker, and actually I have the same question. I couldn't quite hear what Leda said about the crossover, so could she explain that again, please? Thank you.
Sure, thank you. Can you hear me?
Yes.
Yes, when I spoke about crossovers, I meant about the interactions between, in this case, the interactions between COVID and climate change, and the double challenge that they're now posing. How business has been disrupted, but how it's also a chance to change. Well, things change in an accelerated manner, and things innovated, and it just happened right before our eyes. So crossovers means kind of how one thing affected the other, how COVID affected climate change and vice versa.
Okay. If there are no other comments, and thanks very much, Leda, yes, also from Odile. If there are no other comments, I would then like to start with the partnership, and we have more time later, maybe also to take a few comments more, and maybe also to have a few additional discussion points forthcoming. Therefore, I would like now to introduce the first speaker, Miss Dorota Tomalak, who is the Deputy Head of Unit of the European Committee of the Regions. Dorota, a very simple question with a long answer, probably. Where do our health priorities merge? And how can we best implement together?
Thank you very much, Bettina, and good afternoon to everyone, ladies and gentlemen. Добрый день, дамы и господа. Я хочу поблагодарить правительство Москвы за приглашение.
Good afternoon, ladies and gentlemen, and I would like to thank the government of Moscow for invitation.
Summarizing your beautiful language and just continue in English. We gathered today actually to discuss very practically how we can work, how we can cooperate across boundaries. And we see that these boundaries quite often break us into separate silos, policy silos and also governance silos. I believe the Regions for Health Network is actually a living example of the fact that these silos need to be removed, the barriers need to be broken down to serve the greater good. And actually, 30 years ago, when your network saw the day, was when my EU institution was also funded. It was the Treaty of Maastricht 1992 that formally recognized the right of cities and regions to have a say in health policy. And now the Committee of the Regions is the place where it's happening. The EU cannot legislate, cannot have new rules on health without asking regions and cities for their say. And I don't mean people like myself, administration, I mean the members, the mayors, the councillors, and presidents of regions just like yours. The committee represents actually over 1 million politicians elected at subnational level. Think of it for a second. It's like 1 million decision makers, 1 million people who vote on budgets, set agendas, decide on quality criteria, inspect projects, make big decisions. And these are the people who stood at the front line of the fight against COVID. They fought for respirators. They set up new COVID hospitals. They begged retired doctors and medical students to come to service, just like you do in Moscow, as we heard yesterday. They saw the incredible damage made to local social and economic tissues. But they also, with this experience, learned actually just how important public health and partnerships are. I mean, up until recently, health was seen as a bit of a soft policy, whereas now it's been really catapulted into the limelight as part of strategic security. And we know that nobody is safe until everyone's safe. So multilateralism and collaboration are really key elements to succeed. And this is actually what Committee of the Regions and World Health Organization Office for Europe have been doing for years. We have over a decade of successful joint projects behind our belt, so we can say we're no novices here. And 5 years ago, our top bosses actually formalized this cooperation by signing a memorandum of understanding. Earlier this year, right in the middle of a second wave, Dr. Kluge and our president, Mr. Tsikostas, signed the second generation action plan, again setting an ambitious agenda for our organizations to follow. Within that action plan, Regions for Health Network is actually given a greater role, a more prominent role, to take that collaboration to the next level. So what are the key areas of work that will focus together? It's the resilience, it's the immunization, it's the health prevention. Let me start with the immunization. Of course, we all now say that how successful the EU campaign was and the progress we've made. Still, there are large pockets of unvaccinated communities that still remain hesitant and fearful. We do have people in our closest family circles, in our neighborhoods, who, fueled by fear, maybe ignorance, maybe motivated for political or religious reasons, still refuse to get the protection. And they need support, they need conviction to actually change their ways. And their decision affects their life, their health, but it also affects communities who cannot achieve herd immunity without everyone being on board. Reaching out to those people is something that can only happen with the most intimate knowledge. You have to tailor the message to their needs. You have to know where to find them. You have to make access to vaccination as easy as possible. And again, here, we heard yesterday about Flanders, and it's 95 centers set up in, 6 weeks? So that shows really that the answer is not at the EU level, it's not at the national level, it's at local and regional level. Our second topic means for us antimicrobial resistance, it means pharmaceutical strategy, it means fight against cancer. I mean, we've learned now the hard way what it means to be affected by a new virus. I mean, we got lucky. The international research community came up with answers, developed a vaccine in record time. But sadly, we cannot say the same about antibiotics. I mean, no new discoveries in the last, 4 decades? So we know that we need new incentives for our pharmaceutical industry, and also we need to address the rearing of animals. We need to address the use of antibiotics in that sector. So it's looking beyond health, but also into agriculture. Finally, resilience. That's the topic of the year for this and next year, of course. Here at the committee, we will work across our political departments, bringing the experience and expertise we have in environment protection, in climate change, in biodiversity, in civil protection, trying to blend instruments and concepts together to help our members work on the resilience of their constituencies. So we will, for instance, work with them towards planting 5 billion additional trees in Europe, helping to protect the biodiversity, but also lower the temperature in their cities. We will help them devise their preparedness and response plans, helping them address next major health scourges, but also natural disasters. Finally, we will assist them in modernizing their health systems. In all these endeavors, we actually count on Regions for Health Network, because your knowledge, your expertise in global and local health issues is beyond compare. Our membership partially is the same, but mostly just complement each other. And where we have our European Union knowledge, you bring that unique perspective of the WHO to the table. And I think we can take actually the best of the two and intertwine together to best serve regional needs. So this actually is what happens today for me. And I very much hope that will happen more in the coming weeks and months. We at the committee stand ready to work closer and more often with you. And also, I want to say it loudly, our events, our activities are open to you. We are eager to engage you in whatever way, be it a bilateral exchange over Zoom like the one we had with Bettina a few weeks ago, or an international conference in 4 different cities like the one we held in 2019. We're eager to work together, because together we're stronger. And together we can make a difference. Thank you very much, ladies and gentlemen. Спасибо за ваше внимание.
Thank you for your attention. Dear Dorota, I would like to extend my gratitude for these warm words in Russian, the warm words of welcoming. Thank you very much indeed. I am surprised by the scale of influence of the network on the mentality of people who are taking decisions at a local level, taking into account the value of sustainable development. It is 1 million people who are sharing these goals with us. This is indeed an incredible performance. It is already sufficient to state that the Department of the European Committee of Regions that you represent, it is indeed working very efficiently. We have a question to you. We have a question in the chat. The European Committee of Regions is a body of the European Union that is dealing with a broad range of different issues. And the person who is asking question is interested in the following. How could you pay more attention to the issue of health as part of your organization? And the second question, have you thought about closer cooperation with other organizations in order to reach the goal that was set? Dorota, I think that your presentation already contained answers to these questions, but if you will, could you please say it again or build on that?
Of course. Thank you very much, Evgenia, and thank you to the person who actually is asking this question. Indeed, as one of the EU institutions, we cover a broad range of policies. So it's not just health. We have departments in charge of energy, for instance. We work on cohesion. We work on social policies. We work on culture, on agriculture, on fisheries. everything is in the package, but actually it's part of it's our curse and our blessing. We cannot be as specialized as you are. We don't have the same degree of knowledge and the same amount of time we can dedicate to health issues. But what makes us stronger is that we've got all these other policies, these other specialized people within our service who can actually give us that other perspective. We've been talking a lot about climate change and COVID, the connection between the air pollution, for instance, and diseases. So these connections can actually be made, and it's very important for local politicians. I mean, some of them, will be managing huge budgets, like the president of Bavaria will probably have the higher budget than of the president of Czech Republic. But you will also have politicians in their hamlets with 30 people. And these people can get the same exposure to the same topics, can learn from each other, can get inspired, and can make a difference, be it on a huge level or on a very, very small one. So this is, I think, where we can really bring that combination, that blending of different concepts and strategies. Our cooperation with other networks, it's of course happening a lot, be it the network, specialized networks of the WHO, but also the non-government community, both at the European level and also nationally. We work a lot with networks in Brussels. Caroline, Giovanni will attest to that, but there are also, of course, others. We work also a lot directly with parliaments. We've got a special connection, special channel of communication and political work that we do with regional parliaments, especially those who have legislative powers, because that's where, of course, a lot of policy making is being made. So there's a lot of that as well. And of course, normal connection between the European Commission, European Parliament, and people like that.
Dorota, спасибо большое.
Dorota, thank you very much. You have now basically explained the model of an efficient functioning of any network and of efficient collaboration with your partners in different associations, networks, and on all the vertical of power that exists in our countries. Today, at the end of the session, we will make conclusions, and one of our conclusions should be the development of efficient collaboration between other partnerships and networks. And you have basically answered this question already, and when I sum up, I will take into account all the elements that you have now shared. And now I'm happy to give the floor to our next speaker. I would like to give the floor to Mr. Giovanni Gorgoni. Mr. Giovanni Gorgoni represents the European Regional and Local Health Authorities Network. It is another network that is working at a local and regional level on special issues that are related to functioning of the health authorities. Mr. Giovanni, you have the floor.
Thank you. Thank you, everyone. Good afternoon, everyone. And thank you for the prestigious invitation to the conference. Euriga, that I represent as a chair, has been representing for almost 10 years the request of the regions of the European Union member states on the issue of health and social care. And over the past 10 years, we have increasingly understood how health as a backbone of the community integrity must pass through assiduous dialogue with the regional authorities. The simple vaccination policies have been settled out by continental and national level, but they have been put in place with different intakes in the local context. During pandemic, we collected so many good practices from regional realities on COVID fighting in terms of technology, in terms of therapies, and so on. I don't mean that the national authorities are not up to well interpret the requests of their citizens. but we think that the regions are a rational bridge in the continuous tension between European and national policies that guarantee efficiency and local practices that offer effectiveness, cause greater proximity to the need of health. We have followed the work of the conference of the previous days, and we agree on many concepts expressed. Three concepts in particular reside firmly in Riga's strategic action that we like to mention today. First concept, ecosystem. Ecosystems, both strictly meant as natural and climatic ecosystems to be protected, and as broadly meant as socio-cultural and productive ecosystems. This must the new and unique paradigm, to design policy and to implement practice. There are no alternatives, and it finds practical expression in our efforts on the direction of the smart specialization strategy, the European approach that brings together the different needs and potentials of a regional reality. Second concept, cross-border proximity. Many contiguous regions belonging to different states share many more health and social needs than with the regions of the same state of belonging. During pandemic, narrow and the usual people exchange in cross-border communities have been a threat, and it should be a point of strength. Trimming them mediated the national solutions is not a fair answer. Providing them with the concerted actions of cooperation between states is simply an honest and consistent answer with the reality. In Eurigo, we have carried out various projects that go in this direction, that represent also in this case an ecosystems response. Third concept, value. Value in health meant in a broad meaning, in a broad sense, as an overall health outcome for the citizen. Value as a technical and scientific equality of care. We saw valuable and not valuable social intervention for to cope pandemic, valuable and not valuable therapies to cope pandemic, and so on. Value as a personalized response based on the characteristics of the individual. Value as a fair distribution of investments based on demand and not on the basis of wealth. Value as a mean of social inclusion and civil cohesion. Value-based healthcare, with the broad meanings of the European Union, is the methodological framework we have chosen to do things, because it can solve the complicated equation between health universalism and financial sustainability. Our hope is that the global system disruption led by COVID may represent an opportunity to rebuild a new future building using more manageable regional bricks rather than national blocks. State prerogatives must be safeguarded, but we should use an approach closer to the places where health is maintained, preserved, or lost. The last hope is to meet again soon. Thank you.
Thanks very much, Giovanni. I do not see a question here, but my comment to you is the three concepts you have mentioned: ecosystems, cross-border, and value in health, value-based in health care, are long-term throughout actually decades. And I think it's very interesting to merge this long-term thinking with what the Committee of the Regions has just said, and also what we discussed, COVID and climate change, over the last days, right? So it applies across. So therefore, Giovanni, thanks very much for this additional thinking you provided to us. Then I would like to introduce Dr. Luis Zaboga from UFA, and he is the president of the Health Promotion Section. I see him connected. And you will be speaking about your activities in order to promote, for example, promote health for our future collaboration. Are you connected, Luis?
Yes, I can hear you very well. Can you hear me?
Yes, Luis, the floor is yours.
Thank you very much. And thank you very much for organizing and inviting us to be part and share some thoughts about our activities in the context of the present situation. So I'm presenting you, EUFA, as an organization that is multidisciplinary, it's international, and we are bringing together public health experts for professional change and collaboration through Europe. And also we try to organize the last and largest public health events in Europe. So we do encourage this multidisciplinary approach to public health. We have been constructing this network. We are today 43 national associations of public health, 27 institutional members, 8 individual members, 2 global members, and 13 partners. So we are actively engaging with not only colleagues on the public health scene, but also from other environments where knowledge can be produced and translated. We are trying to voice our knowledge and enhancing capacity through a strategy. We call it the EUFAS new strategy based in the AAA approach. So analysis, advocacy, and action. So these are the AAAs that we try to somehow give a backbone to our activities. Every year we are organizing the European Public Health Conferences, and you are invited also to join us this year for the Public Health Futures in the Changing World that will be taking place in some days, from the 10th to the 12th of November this year. Actually, the European Association is divided in sections. And one of these sections are the health promotion section. We are about 5,000 members actively engaged. And we have been also trying to figure out how to voice the experts' opinion around public health topics. So I just would like to pinpoint the Vienna Declaration on Health Promotion in November 2006, where we raise awareness and we try to amplify the existing message on the 5 specific public themes in line with key organizations at the European level. Sorry. We also participate actively in the report on the healthy and sustainable diets for Europe, European countries. This was in May 17. We made several statements, like, for instance, on proposal for the next EU budget in 21-27. We are actively engaged in some issues like e-cigarettes with the declaration in August 2018. We were also partners in the European Confidence Seminar in Brussels in November 2018. And every year, we are now activating what we call the Public Health Week. This is an initiative that the European Association is trying to implement, where you are very welcome to participate, bringing your expertise and your knowledge in order to develop a common ground in public health in Europe. between other dissemination strategies that EOFA has, so there are the newsletters, we have the several accounts that can be found in the social media, and basically we also want to share the knowledge and make this transferable to several other perspectives, like the European Journal of Public Health that we are responsible for publishing, the European projects where we are involved, like for instance the Serious Gaming project, where we have just today had a meeting on how to transform something very serious into the gaming perspective in order to activate not only the motivation but also the participation of different perspectives and colleagues. Just to sum up, I would like to share with you the statements that we produced related to health promotion and COVID-19. This is published. By the way, I will use now the chat box just to share with you some of the links where you could meet us and also deepen your knowledge about our activities. Let me see if this works. Well, yes, hopefully you got it. And so I'm just mentioning to you the health promotion focus on COVID-19. We wanted to call perspectives into the debate of how to keep this Trojan horse out of our health systems and to promote health in all times and crisis and behind. What is at stake here is to put again, or to put back in a different perspective, what we call the big issues of intersectionality, sustainability, empowerment, and public health engagement, equity, and the life course perspective into the COVID-19 issue. So this was another of our activities in order to respond to the crisis where we have been involved. So a lot more could be said, but please refer to some of the links, and you are very welcome to ask your questions and make suggestions.
Спасибо большое, доктор Луис.
Thank you very much, Dr. Lewis. I'd like to mention these links because probably everybody will take an opportunity to go to the links promptly to dive deeper into the information. Let me go to the link. Maybe in several minutes we will have some questions to you among the participants of the chat and us as moderators. So far, I'd like to introduce and give the floor to our next speaker, Mrs. Caroline Hostens. Ms. Caroline Hostens, the Director of a non-government partnership and different agencies, EuroHealthNet, working in the public healthcare, the proliferation of information, health improvement and equity. Ms. Caroline, please take the floor.
Yes, thanks a lot for the invitation and the introduction. It's a real pleasure to be here, and it's also really nice to listen to Dorota and Luis and Giovanni and to follow up on their excellent work. So yes, the Regions for Health network is an important network to us, EuroHealthNet. And I think we do have a long-standing relationship with the network, and we have already cooperated in the past. So I'm therefore even more delighted to be here. So for those of you who do not know EuroHealthNet, we bring together organizations, over 60 organizations now, mainly national public health institutes, several ministries of health, like from Norway, Slovakia, Spain, and also several regional health authorities like Västra Götaland in Sweden, Wales, Scotland, also in Italy, like Puglia, Tuscany region. And the work of your HealthNet centers mostly on reducing health inequalities and tackling the underlying causes of ill health and disease, so the social determinants of health. And we are based in Brussels. We have an office of about 15 people, and one of our core activities is to monitor EU policies and instruments and see how they can be applied to promoting health and health equity and sustainability, and looking for funding instruments, and also facilitating work with our members and making sure that they have the opportunity to indeed influence the European policy agenda. We also facilitate the exchange of good practices in country exchange visits, and we develop project activities together. It may also be of interest to you that we are linking and networking all the communications professionals of our members and the PR people, the press officers, so to have a stronger unified voice for health equity. And as communications has been part of your discussions this week, it may be nice to make linkages there, because we need to be better in tackling fake news and not the trust in science and how we communicate about science and our results. We've also set up a portal on health inequalities, a big resource with many useful publications and findings on health inequalities, and we would be happy to include your publications in our portal. It's available in many different languages. It may be of interest to you that we've also just developed our new strategic development plan that we will actually publish next week, together with our new website.
This is place.
Recording in progress.
Exercise, and I can really recommend for your network to also do a similar exercise, because it's nice to look at the horizon and then do a backcasting to see what we need to be active on now. So some of the areas, so 5 thematic areas came out of that we included in our strategic plan. The first one is health equity, not a big surprise, but this allows us to work on social justice, on employment, education, following the European Pillar of Social Rights. The second area is non-communicable diseases. This includes obesity, sustainable food. It's linked to the European Beating Cancer Plan. And we want to address the commercial determinants there, because they are so important to tackle. The third area is the climate crisis. As we all know, we will look into air pollution, green spaces, nature-based solutions, and particularly look at the developments in the EU around the European Green Deal. The fourth area is strengthening promotion and prevention. This is about, within healthcare services, shifting from care to prevention, strengthening primary care, community care, integrated care locally. And our fifth topic is the life course. This is about intergenerational inequalities. It's about health of young people, but also healthy aging, and already looking towards demographic changes that we are facing. Then we have 2 cross-cutting topics that are important for all those 5. And the first one is mental health, and the second one is digital health and digitization. So in these topics that I know were also on your agenda this week, we want to work over the next 5 years And here we take a global approach, which is linking the global with the local and realizing that a lot of change happens from bottom up at the local level. So EuroHealthNet is interested to work more with local partners and with regions to see what we can do there and work together. We will also set up a help desk that encourages our members to access European Union funds, so European Social Fund, ERDF, lots of funds that are also dedicated for regional and local levels, and to explore new ways of financing health promotion and prevention beyond the EU, and looking at investors and really concentrate on making investable solutions to see how we can design and repackage our work in such a way that it is attractive for policymakers and investors to take up immediately. Also with an eye on the national recovery plans that many countries have. With all this, we hope to work towards an economy of well-being, which is a very interesting concept that we fully embrace and that we can only achieve by working together. So again, I appreciate to be here. I appreciate to work with RHN, but also with the other networks that are present at this panel. Thank you.
Спасибо, уважаемая Каролайн. Если Каролайн не возражает, я, как обещала, вернусь с вопросом к Луису. Я для тех, кто не успел...
There are some questions to Luis. If you haven't managed to get acquainted with Dr. Luis links, the first link is about the organization which Dr. Luis represents. The second link, very important one, and it might be of interest concerning the conference which took place from the 10th to the 12th of November, the European Conference on the public health care, which is a very important event in healthcare. The key topic is going to be the future of the public health care in a changing world. Online, I'm looking at the information. There is a brief research which is all the focus on strengthening health in COVID circumstances. And there are two questions to Dr. Luis Saboge. The first question, the exact word on the following, and you threatening information on climate change are published daily. Is it a situation where we need to act promptly? Does it mean that the subnational organizations in healthcare should be involved in this work? Or it is necessary to stick to a major mandate connected with health and to leave the solution to the climate problems for other agencies? This is the first question, and it is a very interesting question from my perspective, since the environmental and the climate question has a direct impact on the health of an individual person, on the population health. Therefore, this is the first question. Dr. Luis, your answer, please.
Thank you very much. This is an overwhelming, important question, and I would emphasize what I just said previously, because we need to work in an intersectorality approach. So climate change cannot be out of the scope of health promotion, and health promotion cannot develop its activities without the emergency of climate change and all these issues that are related to what we are now facing on planet Earth. So we are very much committed to this agenda, and sharing the net and sharing knowledge and also impacting changes in the lives of the persons is one of the most relevant issues that health promotion takes on its shoulders. I don't know how much time I have to answer this question, because this would give us a lot to enhance in a very specific way. But just I could give an example, a very precise example. You take health literacy and the impact of health literacy in the decisions of everyday life of European citizens, and not only European citizens. So when we take the approach that health promotion by health literacy is trying to implement at the level of the households, of the individual, of communities, of countries, regions, we can see that as we increase health literacy, we will impact on climate change circumstances. Like, for instance, the nutrition, the way that people are eating today, it's one of the major climate change consequences. And changing this and adapting and claiming, I thank you very much. Thank you very much, Caroline, for her input, and also by using this very nice word, the global approach. You see, when we look at the global approach from the perspective of health promotion and what people could be doing from the global perspective in climate change, health promotion has a very relevant contribution to make. And just speaking about nutrition, but we could expand this to very other domains. I don't know if I can use more time, because indeed this is a very
Уважаемый Луис,
Dear Luis,
очень важные слова, но я
a
вынуждена
very
на ваш
important word,
вопрос
but
сказать, что
I
пока
have
нет, хотя
to
к вам есть еще
say
вопросы, если не
no.
возражаете, мы будем идти
If you
жестко
have,
в графике,
if
но если
don't
у нас
mind, we
останется хоть одна
need to
минута
follow our
свободная в конце,
timing. If you have
у
extra
меня
1 minute,
просьба к доктору Луису
I would ask
не
Dr.
исчезать
Luis
из нашего
not
пространства,
to
потому что к нему
disappear
есть
from
еще
our
вопросы,
conference,
которые озвучу,
since
если у
there are
нас будет на
several
это
other
дополнительное
questions
время.
voiced in our chat.
И
If we
есть
have
один
additional time,
вопрос
we will
в
ask these
чате
questions. And there is one
к
question in our
Кэролайн.
chat to Caroline.
Кэролайн, вопрос звучит так.
Caroline, the
Как
question is the
проходит
following.
борьба с фейковыми новостями?
What do you do in order
И
to
часто
fight
ли
against
такие
fake news?
новости попадают в сеть
And
по
how
вашей
often does such
практике? И
news get
парочку
on the
примеров.
internet from your perspective? And a couple of examples, please.
Thank you for the question. I wanted to follow up also that what Louise was saying actually is on the climate change, is that we in December we will have a meeting with our members to discuss what the approach is of us health actors in terms of climate crisis, and what can we do, and how do we want to build capacity. I think that's really important to continue to be in dialogue with each other and to share how we can how most active in terms of mitigation as well as adaptation to climate change. But in terms of the fake news and in terms of the information on the overload of information on the internet, that is an increasing problem for us to see how we can support citizens and people to navigate through all this. And we approaching it for now on building the health literacy and digital health literacy of people. In fact, we are organizing our annual seminar on the 7th of December, and you are all welcome to join us. This is on digital health literacy. On the one hand, we are looking at, okay, how can health services make sure their digital interfaces are developed in such a way that they are user-friendly and that everyone can access information? And at the same time, what can we do to build skills of people, of children, young people, up to older people on navigating on the internet, on interpretation of the information, and to apply the information that is there and credible to their own lives, as well as looking at social marketing, how we can use the media and social marketing tools to provide the information we want to give on alcohol, on tobacco, and so on. So a group of members in Your Health Net have just set up a working group under the leadership of Santé Publique France, so the French Health Institute, together with a Dutch Health Institute on social marketing and alcohol and tobacco to see, okay, and to learn from each other. So these are two activities.
Caroline, thanks very much. Could you share in the chat, the link to these different meetings? Because I'm sure several of our participants are interested to join, and also the UFA, of course. Right?
Yes, of course. It will all be sent and disseminated, I think, next week.
Okay.
So as soon as I have
fine.
the links for sign up, I will share it with you. Yeah, not a problem.
Thanks, Caroline. Thanks, Caroline. I now would like to give the floor to Alice Ryle from ICLEI with a question. Alice coordinates the green infrastructure and biodiversity. So very much linked to our day 3, so of yesterday. So what are you doing in your nature urban activities and health? What are you promoting? What is it what you're doing? Thanks.
Thank you very much, Bettina, for giving me the word, and thank you very much for the invitation. And I can just reiterate what other speakers have said, that it's very interesting to hear from all of us, all of you today, and I see and hear many synergies already, so I'll try and address some of those.
Can you speak closer to the microphone?
Yes, I can.
Much better.
Yeah, much better. Thanks for letting me know. So just a quick word to ICLEI, Local Governments for Sustainability, because the acronym is not necessarily self-explanatory. ICLEI is a global organization, a leading network of local and regional governments committed to sustainable development. And we essentially believe, similar to many others in the room today, that local action really drives global change, and we really need this local and regional leadership of local and regional governments to actually make and frame and influence global policy making as well. We work with more than 2,700 local governments via 22 offices. So we really have a wide impact and a great network. And we work through, or our work is guided by 5 pathways. One of them is low emission development. The second one is nature-based development. The third one, equitable and people-centered development. The fourth one, resilient development. And the fifth one, circular development. And health plays a role in all. But in our current work, it particularly plays a role in the nature-based and in the low emissions development pathway. And here we really try and bring health into our work via EU-funded projects, but also directly by working with our members, and also, and I think that's very important also for us today to discuss, through our advocacy work at European and global level. I'll share a practical example of how we bring health into one of our projects, or how it influences, shapes a project connecting health and nature, before I go into sort of opportunities I see in collaborating more between the organizations here today, but particularly, of course, RHN. Go Green Roots is a European Horizon 2020 funded project, which takes the 360 degrees health approach. And it focuses a lot on mental health and well-being, as well as physical activity, and of course, social health and sort of human nature interaction, all in relation to urban nature. It has 3 overarching questions, I would say, which it tries to answer in the 4-year period that it's running. One of them is active travel. So really to understand how can active travel be encouraged and benefit citizens more via more and particularly adequately designed natural landscapes. So how the way urban nature is designed, but also is let grow and is managed, how that can help active travel. Next to active travel, the second question the project focuses on is restorative spaces. So we all, of course, know that nature is good for your mental and physical health, but it also tries to fill a gap, which is, it tries to fill it by answering the question of what role does nature play in not just changing sort of the stress or reducing the stress via nature, but also increasing psychological resources for coping. In other words, what role does nature play in psychological recovery? And I think that's another sort of dimension to what the discussion is between climate and health, is how does biodiversity loss impact human health? I think that's something where we don't have enough answers yet. And it's vital because we are also next to the climate crisis in the midst of a biodiversity crisis. And the third point is digital placemaking. So in other words, how can location-specific digital technology support and facilitate deeper relations between citizens and public natural spaces, and through that also promote health. So that's one of the practical examples. We work with 6 cities who actually implement natural interventions to test various aspects of how that can promote and benefit health. And it's a very interesting project which really tries to provide many answers to questions that are still open. And for the last couple of minutes, I would just try and summarize what we thought has been the most effective way in terms of promoting health, what our priorities are, and third also what we think we could all bring to this table as a network or as networks. What has been very effective to bring health into the awareness, the actions also of local governments is to foster city-to-city exchanges within European projects based on local implementation goals and projects. So not just within the research projects, but really see what's happening on the ground, what do cities want to achieve, and then exchange on aspects around health and nature on that. The second is also, of course, trying to integrate health across local government departments. Sounds logic, is still a challenge. And using local work also as a means to showcase what can be done and how advocacy could be informed at a more European and global level, and really try make health sort of as integral ingredient of policy making as well. Our priorities for the next couple of years are that we really want to promote nature for physical and mental well-being via planning, policies, and implementation across departments by identifying particularly policy synergies. And here, cities with nature and the newly launched regions with nature platforms, I think would be a great tool, which we could discuss further to sort of see cities can commit to sign up to these platforms and showcase what they do with regards to nature and health, next to other projects, next to other topics as well. Co-creating and co-maintaining nature to foster activity, mobility, and better health is something that's of priority for us. And we also support the Green City Accord, which again invites cities to sign up and provides them with guidance, support to see how air, noise, water, and soil pollution can be reduced, all with the aim of increasing human health, also in line with WHO guidelines, actually. And finally, how can we work better together? I have 5 ideas, some were already mentioned. One is, I think, if we identify common priorities of importance for our constituencies, but also, of course, challenges, in our case, the local level, that would be a great starting point. Then, based on that, to secondly join forces to work on these priorities and really try and be at the forefront of finding answers and providing guidance and evidence to help shape policies at EU level. I think that's important. I think there's so many experts in the room here that how can we help guide policy making? And of course, there are public consultations. So if we jointly issue statements towards public consultations for relevant EU policies and try and bring health into the aspect, I think that's also a great tool. But also providing, and that goes back to, of course, what Luis and Caroline said, easy to understand and communicable evidence to link health with relevant regional and local.
Dear Alice, I'm so lucky to have a statement on your presentation, but unfortunately, I have to interrupt you now for the timing issues. I'm representing the Climate and Nature Department, and we know that 1 year ago, WHO published a report on biodiversity and bringing nature back to cities. That's an amazing document that is a true guideline for us, and I was basically writing down all of your recommendations regarding efficient cooperation, and I will get back to your proposals when we sum up the discussion. Thank you very much indeed. I really benefit from what you are saying, but unfortunately for time's sake, we have to move on. I give the floor to Mrs. Joan Devlin, who is the Executive Director of the Healthy Cities Network. This is yet another well-known network. John, you have the floor.
Thank you for your welcome and for the invitation to be part of this panel. Previously, we have worked with the Regions for Health Network, but there are increased opportunities to work with the Regions Network. We've also worked with a number of the other networks that are part of this panel as well. We've used some resources from EuroHealth Network. We've worked with ICLEA. So we have worked, but I think there are opportunities now. We are all working on the same issues. For people who don't know a lot about Healthy Cities, we are now in our 7th phase of 5-year frameworks. The framework it's a little bit like the regions. The framework is established by WHO, and the application is made by the highest political person in the city. There is a maximum of 100 cities across the 53 countries of WHO Europe, and each country has a quota according to the population, and that's really to make the network manageable. With that, there are a large number of national networks. I think we have 24, 25 national networks, and within those there are a large number of cities and towns who participate in the national networks but who aren't necessarily designated healthy cities. Currently, we are in phase 7, as I've said. It's very much aligned with United Action for Better Health, and we use a 6P framework, which is people, place, participation, prosperity, peace and planet. And that's within that there are a number of issues that cross each of those themes, and cities make their application based on those issues. And I think it is important that we're all working on the same public health challenges. We work on equity, we've long experience on working on environmental issues. Healthy urban planning was a concept introduced way back, and I think in the late 1990s. More recently, we work on health literacy, and we have significant experience at the local level of working intersectorally. And many cities within the region work on those social and environmental health determinants. And I think during COVID, cities demonstrated that they could move very quickly. If we look at the issues around active travel and green space, cities opened up a lot more space because of the social or physical distancing restrictions that were in place. And it is important that we share that experience and knowledge regionally. During COVID, for example, Healthy Cities Network met every week, and we were able to share virtually the experiences on particular issues relating to COVID. Some of the examples were around homeless population, the more vulnerable drugs or the more vulnerable groups, like those who experience substance abuse or addiction, and how cities were dealing with each of those. I also think in that two-way relationship, cities work much closer at the local level, so it's more easily to articulate the citizen engagement and engage cities, and how then that can be fed into the regional or the national level to develop or shape the services that citizens need. Regions could also provide support. I mean, I even look at our own region. If Northern Ireland was part of the Regions Network, then I think that would offer much more support to the 2 cities in Northern Ireland that are part of the Healthy Cities Network. And that broader way of working, bringing in the departments that do not have as such responsibility for health, but that their policies and actions have significant impact, both positively and negatively, on health. And I think regions can act to support cities. Cities are executive in their own, many cities are executive in their own authority, And I think they could also support regions in addressing many of those challenges at the regional level. There are issues around sharing data. Very often there are local surveys carried out by NGOs that don't always reach the regional or national level. And those qualitative surveys are really important in identifying the shaping of local services. One area, for example, is now during COVID, now because it is those that are most disadvantaged or in some cases most vulnerable are not taking up the vaccine. There are a number of pop-up clinics using mobile units being established across cities in those disadvantaged areas to encourage the uptake of the vaccine. So very often it is working at that very local level where we can engage the most disadvantaged. Mental health is obviously another huge issue. It's a huge issue at a regional level, but also at the very local level. And again, it's ensuring that those services are designed in a way that local people can uptake those services. So I think in terms of future collaboration, we have existing. As I've said earlier, I have already been I've attended a number of regional health conferences in the past. Healthy Cities have an annual conference, and I think it would be important that the Regions Network and other networks participate in that conference. I think it's the 8th of December is our annual conference, virtually obviously this year. We also have a number of subgroups. Healthy Aging Task Force has benefited from significant European funding in the past, and that has been very much looking at environmental issues in relation to healthy aging. We also have an Adverse Childhood Experiences subgroup. We have a group working on place and inequalities. And we have just recently established an urban preparedness group. And our experience is that it's often by bringing people from other sectors into those working groups that they see the benefit of participating in the European networks and the benefit of participating in those small working groups where we can pilot tools, we can pilot pieces of action and then learn from those and share them with the rest of the network. But I think those would be two concrete ways of going forward at the minute, and I think there are a number of others that we could certainly explore. One of the issues that I do think is important, very often Healthy Cities operates on a shoestring budget, a bit like the regions, and we have to ensure that collaboration is collaboration and doesn't become competition. Most Healthy Cities we have to have a Healthy City coordinator, but it's trying then to use the resources from across the health sector, from across the environment sector, and particularly now I think COVID has offered that opportunity, for want of a better saying, that at a local level, sectors are more willing to work together to tackle the challenges of climate change, and of other issues, and work closer with local citizens.
Thanks very much. Yes, I needed to.
Yeah, but that's
I just want to let you know, at the regional level in WHO, we are also now collaborating on seeing how we can best alienate, synergizing these two networks, which are both secretariats handled by the WHO. Now have the pleasure, thanks, and there is a question in the chat, just look at it, but I believe you answered it already. Okay. Now, I would like to introduce Dr. Inge Heim. Dr. Inge Heim is the co-chair of the HIC, which is the Housing Climate Change Working Group, which is a member states working group. Inge, very short and up to the point. Can you tell us how we can cooperate best, and what is it, because you're dealing with climate change? 38 member states, and I think the region can be also very much cooperating or collaborating. Thanks very much.
Okay, Bettina, I'll make it short as I can. So our working group on health and climate change was established in 2012 under the mandate of the European Environment and Health Task Force, which is the leading international body for the implementation and monitoring of the European environment and health process in WHO Europe. The working group consists of representatives from European member states and other partners like European Commission, ECDC, UNDP, NGOs, etc. And it promotes dialogue, communication, and collaboration in the WHO European region on protecting health from the adverse effects of climate change. It also advocates for the integration of health considerations into national climate change mitigation and adaptation policies and acts as a catalyst in promoting, implementing, and monitoring the global and regional policies. So the year 2021 is a pivotal one for international climate action, with far-reaching implications for the health and resilience of communities and societies. The 26th UN Climate Change Conference, COP26, which is taking place in Glasgow next month, offers key moment for the health sector to show leadership on climate action. It provides countries with a historic opportunity to agree upon an evidence-based path to a zero-carbon future and to incorporate at the same time human health considerations in national and international decision-making. So to encourage parties to take this opportunity, the WHO launched a special health report that outlines the health case for climate action. So in May this year, we organized the 9th meeting of HIC. It was organized as a two-day event in close partnership with the global WHO Civil Society Working Group to advance action on climate change and health. HIC invited representatives from civil society health organizations to take part as observers in the first day, and they invited HIC members to be observers in their meeting on the next day. So it was an example of good communication and collaboration. So as an outcome of this meeting, HIC developed Zero Regrets paper on scaling up action on climate change mitigation and adaptation for health in the WHO European region. It aims to support the health messaging at upcoming engagements on climate change and health, such was the 71st session of the WHO Regional Committee for Europe. Then it will also support health messaging at COP26, as well as the formulation of commitments to be put forward by member states at the 7th Ministerial Conference on Environment and Health, which is expected to be held in 2023. So HIC joins the COP26 health program in calling on governments, businesses, and financial and civil society actors to put health in front and center of the global response to the climate crisis and the recovery from the COVID-19 pandemic. Now, how can we work better together? So part of the HIC's agenda is United in Action for Better Health. So all networks can work together with the intent to raise awareness about the links between health and climate change, as well as the policy options that can maximize the benefits for health and the environment, and indicate areas for action and collaboration across sectoral boundaries and social actors. Now, I've made it really short, and I hope everybody has understood what I wanted to say. Bettina, Thank you very much.
Excellent, excellent.
Огромное спасибо.
Thank you very much indeed, Inge.
Вам и вопросов, и добрых слов, и благодарностей.
There are many questions to you, and there are many things, and there are also some questions to previous speakers, and allow me to voice all those questions at the end of our session if we have some time left. And now, for time's sake, we have to move on, and I would like to introduce Ms. Bridget Dodson, who is chair of the working group for collaboration of local and subnational authorities. And could you say a couple of words on how the group is planning to use its powers to promote dialogue, knowledge exchange and collaboration between subnational, national and international authorities in the European region of the WHO, how to organize this work in a coordinated and comprehensive way?
Yes, thank you for this invitation to share the work of this working group. Actually, COLSA is like a newborn small baby within the networks that have just been presented by my colleagues. We are a working group, the same as HIC, as presented by Ime. This working group has been established by the Environmental Health Task Force of WHO, and it's quite new. We just actually really started to work in 2020. And what we want to do as a working group is to address priority areas on environment and health that are linked already, that are mentioned in the Ministerial Declaration of Ostroa. So climate change is in there, sustainable health systems, water and sanitation, air pollution, cities and chemicals. And we want to maximize synergy and coordinate with subnational and regional and local levels of government. So this COLSA was initiated by, or it's actually the Secretariat is at the European Centre for Environment and Health of WHO. But we also work closely together with Healthy Cities Network and especially the working group Environment and Health. So we already have a link there. Currently, we have 4 cities in the working group. We have many countries, a couple of Western Europe countries, but almost all Eastern European countries are participating in this working group. So I think this is also an excellent opportunity. UN Habitat is participating. ICLA and C40 also have been participating in our meetings, and also the European Environment and Health Youth Coalition is a member. And one of the things that we currently doing is we're doing a literature review and an evaluation of case studies looking at multi-level governance. So can we find good examples, but maybe also bad examples of, well, what are current governance framework, which are really linking national, regional, and subnational and local activities, but what are the policy and legal requirements that pose obstacles to actions at local level, because there are many examples there that the national legal requirements are not are hampering local implementation, for example, on building issues or sustainable building. And we also are collecting examples on policy myths. This is a little bit related to the fake news that Caroline was talking about, because we see that this kind of fake news, the policy myths, they also hamper, slow down implementation. So we want to know from what's going on and how can we deal with this kind of fake news. The output should be policy briefs for the key priority areas I just mentioned, and provide people at the different levels with facilitators for better implementation of healthy and sustainable policies. But what I said, we're new, just starting, so we hope to come up with relevant information for you in the upcoming year. And with our activities, we contribute to the environmental health process of WHO. and also to the WHO campaign for resilience and building forward better. And well, what already was said by Ingen and a lot of the previous speakers, we need this collaboration across between sectors, across the different administration levels, and with different organizations, with private organizations, with the public. And this cooperation depends on, and now I'm referring to a recent EU project that was coordinated by Caroline Constance in Harrods. And one of the lessons we learned there was cooperation depends on the capability, the opportunity, and the motivation of the partners involved. And one lesson that I learned was from the momentum is enormous importance, and the momentum is there now because we are still in the midst of the COVID crisis. We have the climate change crisis, and we need to make the most of this momentum. And I think that can help us to enormously in finding synergy in our collaborations and working on these united actions. And with this, I want to close my presentation. I know that representatives of the Region for Health Network have also come to our meetings, and I kindly invite you. Well, please do join us, and let's continue working together. And I think, Caroline, that you're a health net. We should, with the working group, also collaborate a little bit more with you, because I see an enormous amount of synergy there. Thank you.
Thanks very much. Thanks very much, Brigitte. I now have, I don't see, the Zero Regret paper Inge was referring to, which is the main publication going to the COP26. It's just the link on the website. There is a question, but I would jump over that for the moment being. And when we have another moment of time, as Eugenia was saying, we will take up these questions, because we have a few more speakers still come. So my deep apologies. I would like to invite a youth representative. Are you there? Yes, I see you. If I don't say it right, Alexandra Arkotovlat. Correct?
Yeah, all good.
You are a medical student, and you are from the Federation of Medical Students. So the floor is yours. I mean, just tell us what you think about how we in the regions can best contribute, improve health. I mean, from what you could listen over these days, and just tell us. Thanks.
Yes, definitely. So I'm not from the Federation, I'm from the European Medical Students Association, EMSA. We're, just for context, because I'm sure some of you may not be familiar with the organization, we're a non-profit, non-governmental organization representing medical students from all across Europe, as the name says. And in our vision statement, we also state that we envision a united and solidary Europe in which medical students actively promote health by empowering medical students to advocate health in all policies, excellence in medical research, interprofessional healthcare education, and the protection of human rights across Europe. So working towards promoting health and well-being in Europe when moving forward, we would like to underline the One Health approach, which has been widely discussed in the past, before as well as during the pandemic itself. And I'm not going to go into that because I'm sure we are all very well aware of what that entails. One part which I would like to focus on, however, is that we don't only believe that this needs to be interdisciplinary, which is something everybody agrees on, but we actually believe this needs to be intergenerational. So moving forward and promoting health and well-being are key in preventing future possible pandemics or endemics, which are, as multiple predictions state, inevitable. When looking at ways to move forward, we are actively looking at the future itself, a future that will affect young people and young professionals as well as everybody else. But one that includes healthcare students as our future doctors, nurses, pharmacists, veterinarians, etc. So not surprisingly to anyone, we as students believe that young people and young professionals, or YPYP as we have called them in our collaborative event with WHO Europe, should be actively involved in shaping this future, not only because we will be the ones working in this future to promote health, but because we believe that we can bring a valuable point of view to the table. Young people have shown incredible drive when it comes to shaping our future globally. So just taking the example, the most prominent example of Fridays for Future as the movement led by young people, we are very, very vocal about what we want, but we need to be given a forum or a seat at the table to be able to speak. While we appreciate everything that was done in the management of health in the past, specifically also during the pandemic, certain areas could have been improved upon, as was later noticed. Well, hindsight is always 2020, right? So we are always smarter after. But including various viewpoints from healthcare students, young professionals, or also, for example, from patient organizations and their representatives could be something that could lead to a possible minimization of, let's call it, a margin of error in the future. The more voices are included in discussions, the more holistic the response can be, which is something that we believe we should always be striving towards. One other vital aspect to consider is also the education of our future health professionals. So various national levels are currently globally working to strive towards more digitalized systems, working towards learning from lessons from the pandemic. However, all of this also needs to be included into the medical or healthcare curriculum in general, as changing the sector can only lead to so much if the people who will be working there are not equipped to deal with these changes. So a digitalized system is great, but if the students or if the future doctors don't know how to work with the system, that won't do anything. Regarding a possible collaboration with the Regions for Health Network, I would love to be able to give very concrete examples, but am at the moment not able to. It must be noted that these collaborations can only do so much on various levels. We deem the involvement of student voices in discussions on the European and global level vital. So we would really like organizations like Regions for Health, like the Regions for Health Network, or also the WHO, to lead by example, ideally an example of inclusivity, which national authorities would hopefully then follow suit. We have very, very basic requests, so to say. So in this regard, we've recently also formulated, alongside other healthcare students associations, a roadmap for meaningful youth involvement, also a little bit in collaboration with WHO Europe, which can be found on our website. This involvement of youth in decision-making processes and discussions needs to be a non-tokenistic one, and that is something that I have always stated in every single speech that I've given on this regard. But we also believe that this needs to be a non-abusive one, and we need to provide a platform for youth representatives to voice our concerns, as well as productive criticism in a manner which will be then taken seriously and put into active action in the future. Thank you very much for having me and for giving me the time to speak. This was the fastest way I could summarize the points. I hope that was okay.
Super thanks to you also, and I hope we can be in contact, please, about a little bit more about the details and learning from you. Now we are 10 minutes, I think, sorry, behind the schedule, and being this the case with Eugenia, we will be taking questions, but maybe it's best we have Chris Brown now doing the presentation, or what would you propose?
Дорогая Беттина, я предлагаю сначала выступить.
Dear Bettina, let's have Chris Brown as a speaker, so for all the speakers to have this opportunity, and then we shorten our summary, but we will give an opportunity to the speakers to answer 4 very interesting questions in our chat, okay?
I'd
like to give the floor to Dr. Chris Brown, who is the head of the European WHO Bureau on the investment in healthcare and development.
Dr. Chris Brown расскажет о некоторых.
Thank you very much.
Who's going to tell us about additional?
Okay. I'm just checking that you can hear me. Yes, I can see people nodding. That's great. Okay. Okay, I may or may not follow the presentation. However, what I wanted to say really is I'm really delighted to join the session today and really had the pleasure to listen to those rich exchanges and the themes that have been debated. You know, what I'm hearing is things of trustful societies, strengthening capacities of public health and health systems, investing to increase community resilience, create healthy local places and settings where people live, work and play, managing natural resources, protecting the environment as part of One Health approach to safeguard society today and for future generations, reducing health and social inequities, tackling discrimination, removing barriers by promoting social justice. I mean, these are the themes that kept coming through over the previous days, but came out really strongly from all the partners around the table today. And it really shows us the interdependence of different areas of policy that we really can't consider separately anymore. I think the other thing that it strikes me as, and I'm going to speak maybe first on the well-being economy and our work on that, is that it clearly highlights that economic activity and development policy must be in service to human and planetary health. And for that, we need a new narrative. We need new metrics, tools, and partnerships that will transform financing and investment for health from an expenditure to an investment in a healthier society. And it must do that in a way that delivers improvements on closing gaps in health through investing in public health goods that remove chronic insecurity in terms of food, housing, income, and combat at the roots discrimination that prevent people to participate fully in life and to prosper and flourish. And if we don't do this, we leave many people behind, we will not be able to move forward with any of those things. And this really is the focus of the wellbeing economy. It provides an approach to shape the economy with the objective of building healthy societies that are just, inclusive, equitable, and sustainable. And this is a way of bringing win-wins for people, society, the environment, and the economy, and leaving no one behind. Now, actually, the wellbeing economy is not new. Business practices such as cooperatives, Mondragon, a conglomerate of 89,000 employees in the Basque region of Spain, have been employing a business model of the wellbeing economy for more than 20 years. The work of the Committee of Regions and the EU on circular economy, the work around anchoring, these are all wellbeing economy approaches. The challenge that we have is to make them mainstream, not to have them in a few isolated places and not to have them as small projects. So I'd like to really say something about what the Venice office, which is a centre of excellence for the whole of the European region, including the EU and non-EU member states, around how to invest for health that leaves no one behind and make sure that these health and health equity are core in economic, social, and developmental policies. So if we look at that in practice, what we're doing right now is Venice office has got a mandate to take forward the findings of the recently launched Monti Commission, the Pan-European Commission on Health and Sustainable Development. And is working globally also because we see the interface. We talk about, cross-border health and development. We're also talking about cross-regional cooperation. And there we're working with WHHQ, Global Council for an Economy of Health for All. And we're doing jointly, proactively and directly engaging with economic and financial leaders and organisations to shape financial mechanisms and economic policy to health for all, looking at financing for global goods such as vaccines, UHC, but also looking at investments in public health goods. And as Caroline said, those public health goods are determinants. So what I would propose, having listened to the dialogue and the partners around the table, is that we hold a meeting to say more about this and a consultation with regions on the wellbeing economy to ensure that regional and local settings are reflected and engaged, but also are benefiting from these macro level developments. So that's the first thing. Secondly, if we don't have metrics and we don't innovate in tools and approaches, we're not able to drive an economy of well-being, make it actionable, measure and track progress, and then helping us to engage more effectively and look at where we're going to get the best returns. So knowing that we need good metrics and types of evidence on what kind of investments, what kind of co-benefits can be produced, because we're talking here about co-benefits in the economy of well-being. On the 23rd of November, the Venice office is launching, with the support of Finland and UNK Wales, a new economic alliance. It's a 14-strong international expert policy think tank working practically to generate new investment tools, case, evidence that will support you, me, the cities, NGOs to put these co-benefits into practice. And we will have 2 papers for that meeting, one on co-benefits and the other is a very practical how-to methodology guide on putting co-benefits into practice. If we think, though, about the reality of life, the challenge that we all are saying is that we need to say, how do we do it? We might be convinced on the what and the need, but how do we do it? So some of the things that the Venice office is already doing and will be launching in the next 6 to 9 months will be drawing on what works from inspiring approaches in countries, looking at business models, looking at financing mechanisms, looking at driven initiatives from health and public health. And what we'll be doing is we'll be putting together a how-to online resource, which will be a one-stop shop bringing together real-world examples of mainstream practices in communities, in business, in international organizations, in government that are delivering the well-being economy. We will be also backing that up with structured facilitated rapid exchange, working with Regions for Health, we hope, Healthy Cities, the issue-based coalitions of the UN, which are multi-part and multi-country, and with country groupings such as the Small Countries Initiative, the Western Balkans Initiative, the Central European Initiative, and the Nordic and Baltic states, to really facilitate rapid exchange, adaptation, application. We're not looking for a blueprint. We have to, I think somebody said it earlier on today, we need to go further means we need to be able to adapt and play it in the diverse contexts across the European region. This is how I think we will really accelerate and drive progress. We know also that there's nothing more powerful than one country speaking to another country about how and why. So we are setting up now, and we'll launch at the beginning of next year, deep dives through live policy innovation sites, with Wales and Finland as the 2 first policy innovation sites, implementing a whole country approach to the wellbeing economy, focusing on very, very practical issues, how to, what's it done, what are the policy issues, and what's the learning. And what we'll be doing with those deep dives is taking the learning from those, plus the rapid exchanges and the real world experiences, into a Venice Winter Solutions Lab, a biennial forum for exchange on how to put the well-being economy into practice.
Я прошу прощения, вы говорите невероятно важные вещи.
You are talking about very, very important things about the impetus that can exist. But 1 minute left because of timing issues. We have a very strict timing, sorry.
I actually have finished. Maybe one last statement there is that we know that there's convergence of stakeholders on key problems and the challenges, but there isn't the same convergence on the solutions. So we've initiating a new series of services working with countries and partners using participatory and dialogue-based approaches that will convene stakeholders and beneficiaries around common challenges to big, common solutions to big challenges. And the first one is bringing together youth, health, employment sector, looking at mental health, young people and social inclusion. And we will be starting those dialogues at the end of this year. So I think I'm going to stop there and thank you very much for the time.
Thanks a lot, Dr. Chris Brown. Very, very important taxonomy in our approach, where we need to finance, how to make collaboration for all the stakeholders to understand the common benefit. So we promised with Bettina to give an opportunity to our speakers to take some of the questions. I'd like to urge you, I voice the question, 1 minute for answer. So we have our contact details, and in our interaction we can give the first question to John Dublin. The question is the following: is it possible tighter cooperation with RH and other networks which participated on major priority tasks, on the common priority task? Do you believe it is reasonable? Is it possible? How can you see it should be organized in practice?
A great question, Joan. I mean, I actually think it's the only way forward. It's the only way forward, because what happens in cities is connected to what's happening in regions, which is connected to what's happening at national level. And I think somebody said the local, national, local, international. So what we are doing, I think Bettina said this earlier, is very much as a WHO, looking at what makes sense to the members of those different networks around what to convene around and the issues. And I think this is what we need to get much more advice and guidance from you as members of various different networks as to how we do that. But I think it's the only way forward. I'm really glad you've raised that point. Thank you.
Chris, we also would like to ask Joan from the Healthy Cities, very rapid 1 minute to comment on this. John Devlin. Yeah.
Yeah, I think one of the ways in which we can practically work together is by creating these working groups with smaller number of cities and representatives from various regions, both within WHO and outside of WHO, because very often it's the experts that are missing within the Healthy Cities network who are trying to deliver at a very local level. So I think if we were to create a number of working groups to develop new tools, to develop new ways of working, to look at what those co-benefits are, or what one of the words that we use at the local level now is co-design. That's like another C. How do we design the services with local citizens to ensure they are meeting local needs? So I think through the working groups, and I think actually meetings like this have been very useful, Bettina. I haven't participated in a regions meeting for a number of years now, and actually the input of the other networks and the other organizations I have found highly stimulating and really useful in terms of knowing what is out there across Europe. So I think more joint annual conferences would also be very helpful. And thank you for bringing this to us.
Distinguished friends, we had a question to Alice Rayo, which projects in your organizations you are planning next year, but Alice gave detailed answer with the names of these projects. Thanks her a lot. There was a question to Bridget Stutson on how briefly such a young group has managed to achieve such great success, and Bridget has also answered the question in our chat, so we economize on our time. And we have a question on the students, medical students. So what is the biggest concern for them concerning the future, pandemic, climate change, or many other problems? Top 2, top 3 major concerns for you?
Well, I also answered that question in the chat, but basically, I think we think they're all interconnected. I don't think we can subdivide those challenges. Our focal points are very, very varied. We get involved into a lot of also current situations depending on the time frame. However, in the past few months, also for us, the pandemic has pretty much led the conversation, mostly because we would like to be involved, and we were involved to a large extent in pandemic response. However, not always treated fairly, and quite frankly, not always treated humanely, meaning we were part of our membership reported to being forced into pandemic response and ICU treatments without, based on threats, basically stating, okay, you either do this in the upper years or the lower years of medical education will be cancelled for the time being. Another part of our membership has reported to, if they were working, not being equipped with protective equipment, not being given masks, not being given vaccines. That was all in the beginning of the first few months. So basically, we have been very much involved in just standing up for our membership in the past 2 months, but climate change, AMR, future pandemics, they are all very much high on our agenda, and as well as very, very other points, medical education, digitalization. It's a very broad spectrum. I would invite you to maybe look at our website in that regard and at our policy papers there to get a better image of what we are working for.
Thank you very much,
Bridget. We are going to visit your website. Everybody will be pleased to do that. And the last question, I'd like to switch the mic, Chris Brown, but to be brief with the answer. Quite. How many organizations are you cooperating with, and how many countries are within these organizations? A very brief answer, please.
Chris? Chris Brown.
Chris?
Are you still there? Are you still there?
Хорошо, мы свяжемся, попросим Криса ответить.
We'll ask Chris to give an answer in the last interval when our session is going to end. Yeah, Chris is here. So, Chris, how many countries in organizations, how many organizations you're cooperating with? 2 figures.
My apologies for that. There was a problem. But could you repeat the question? I heard that I have 1 minute to answer.
Да, конечно.
Yes, of course. How many organizations you're cooperating with, and how many countries are involved in these organizations? 2 figures.
Okay, off the top of my head right now, we're cooperating with about 19 different organizations. And within that, right now, I think we have something like about 14 countries, but I just had an email that 3 more countries are keen to join. And just to say, they're not all Western European countries or Northern European countries. They are spread across the region.
Спасибо большое.
Thank you very much for your brief answer. I'd like to give the floor to Bettina, and we start summarizing the results of our session.
Okay, wonderful. I mean, you have been all wonderful, and also the last 3 days have just been wonderful. I would like to announce that there is a questionnaire coming onto the Zoom somewhere, somehow under, correct? In the chat? In the chat. Okay. Okay. So this is specifically more for the Regions for Health, which are connected, but also for you as partners to evaluate on how these 4 days have been for you if you attended, but also if you only attended 1 day, it's fine, right? Just give us your overall rating or opinion. This is number 1. And number 2, together with Eugenia, we have been thinking a little bit about what's next, and we will have a 45-minute session, a closed session with the Regions for Health chairs after this meeting, after the end of this open meeting, to further discuss some of the ideas. So, Eugenia, I think the best is to just start and elongate these things we have been discussing on the future, on what to do next, and then we will be further discussing also in the 45 minutes we will have later. Thanks.
Dear participants of our today's session, today we have had a lot of issues which are very close to what we pointed as very important. The first block is the important things that we need to put in communique, executive summary based on the results of our session and discuss within the closed meeting. And the second block of how to arrange this collaboration within the network. I'd like to tell you about this in detail, but due to the timing issue, I'm going to give you some major statements. It seems to me that the model proposed by the Rhoda Tamalak on the operating of the networks and the cooperation among the networks and different dimensions, authorities, is founding concept and proves to be effective. And the major conclusion that we need to arrange our representative stakeholding in events of each other. And this is a necessary step. Today we talked about the specialization in areas. So Dorota said that it is very difficult as it requires from us great expertise and competence on a big number of different issues. So without going deep into these particular sectors of economy in our areas, it is very difficult to have a particular project implemented. So we believe that the working groups and task force oriented with this special expertise is a very important successful approach. It will allow us to bridge the gaps between our declarations and actions on the ground. The same was voiced by Giovanni Giardoni, great wordings as a smart specialization. These guidelines, the necessity to focus on the real practices in the region, says and proves the fact that within the RHN and our representative office, it is necessary to arrange things.
These could be task forces that are focused on specific issues: how to develop transport, how to develop energy, how to develop renewable energy sources, how to bring nature back to cities. So we could make some small thematic groups. Specialization is necessary, and it requires specific knowledge and expertise, as voiced by several speakers. So I believe that apart from representatives of territories and authorities, we need to have experts on different areas, and we need to think about how every or not every territory could offer some experts who could work in those task forces. There is an important matter related to information policy that was mentioned by Caroline. Fake stories is indeed a problem as of today. It is related to the lack of authentic information and to the lack of portals of every network with cross-links. And working in anticipation is also very important to reduce the number of fakes as much as possible. The next matter is reporting of all the members of our network and other networks. Reporting does not mean that it is a mandatory requirement, because participation in networks is voluntary. Reporting can be voluntarily presented information about priorities in your territories, the goals of your territories, and the projects implemented on your territory. Another important point worth discussing is that there is no doubt that our goals and values of our networks are very close, and bringing ourselves together by common priorities and by common challenges was mentioned by Elisa Rail, and it is very important, and I believe that we have to reflect in the communique those common priorities and common challenges. It is public health, it is environment, climate, sustainable development. And these are the things that will bring together our efforts and aspirations. Another important matter is how to measure the efficiency of our networks and our individual projects aimed at reaching our goals. We could have a methodology that would include a high-level parameter, such as public health or greenhouse gas emissions, or both, actually, as well as development of this methodology is important, and it will allow those who are observing the work of our networks to measure our performance and to feel the benefits of participation. This is a very important task that is now being performed by WHO, and we know that we are already using a number of methodologies that allow us to evaluate various parameters such as activity, transport development, environmental quality enhancement, and so on. I actually took many more notes, but I had to voice only the crucial things. Bettina?
Okay. Thanks very much. Eugenia is full of a spirit of ideas and initiatives and energy, which is just simply, you don't see her on a day-by-day basis like I did now, which is a full and a fantastic team behind. I mean, so it has been a wonderful experience. And for all of you who have been there today, I mean, it's so great. And I'm so much, first of all, thanks that you were on board in terms of partnership. And you know, with all of you, we will be coming back and we will be discussing a little bit more the concrete action points we actually can be taken. Being it in the innovation group, the ad hoc working groups, we will find a nice and sexy name for it. Eugenia was proposing, or being it really at the more higher level across the various organizations, being it on funding, being it on legal aspects, being it on development aspects. So we will come back to you. But I have because we need to jump to our next meeting in a few minutes. I have the big duty, two duties actually now. The number one is I would like to thank everybody I'm seeing in this moment, but everybody who is online from the Regions for Health, all the technical and scientific presenters, all the chairs and moderators, and all the speakers, and everybody who has been preparing an intervention. You know, alone this is a lot of work to contribute to this conference, which unfortunately couldn't be held person to person. We are in the fourth wave, and unfortunately, but I'm sure we will be finding ways to come together. And I can only tell you the hospitality I have had and the team has had here in Moscow has been absolutely outstanding. And I would love to send you some of the things we actually saw and came across. So therefore, let me first thank enormously the team of Eugenia. And Eugenia, I just kind of asked to come here because I mean you can't imagine the IT behind, and the cameraman and the photographer and and the Zoom links. And can you come over? Just come over. The men, there are a few men. Come over. And the gentleman, Michael, etc. Okay, just do you see? You have to come. Can you get the yes? And they're also it's not only female dominated here, huh? There is also some gender balance in the team, right?
Okay. They need to take connection for us. And come here.
Exactly. So they are working now for us for the next piece. And I want also to thank Olga from Mamukino, from the country affairs, who has been enabling and so intensively working with Eugenia, getting this happen, and also Milita Vujnovic. I want to thank Chris, whom you saw before, come here, whom you also saw before, and for everything. And then I want to thank Oil for her support of getting us running over the last months, not being actually available for other issues other than organizing the conference. So Chris, a big thanks for your support, and to the whole team here, which is here, Alvisa and Lazar, but also Leda and Elizabeth and Christina. Do I miss? And Milena, yes, of course, who have been helping behind the scenes, whom you're not seeing or ready to see. So, and then of course I have to thank the platers, right? I have to thank the photographers. I have to thank the deputy mayor. As a last issue, I want to thank the deputy mayor for his availability, and Dr. Hans Kluge and Natasha for opening the meeting and really paving the way on the effectiveness and outcome of this meeting. And yes, I see, Chris, do you have your hand open? Up.
Yes, actually, Bettina, there's one person you've missed, but I don't think you could do it. So I think I would like to do that on behalf of everybody around virtual room and in Moscow. I want to say a huge thank you to you for coming in, bringing such energy, such direction, creating an amazing event. Really fantastic. So thank you, and be safe. I know, you know what I mean. So take care, but well done. And also to the rest of the team. All right, thank you.
Yeah, I know, Chris. Thanks so much. Now, we have done a small. Actually, Christina has with the photos of the photographers here. We have put a small video together. I'm not sure we have the last day, so you might not find yourself. Apologies, correct? We have put a few photos together of the moments of this meeting, and would like them to close through this. And then the Regions for Health. You got another Zoom link with another password to reconnect in actually almost 5 minutes, but we will get it done. And Chris and everybody, let's get the video. Let's see what we did these days. Also behind the scenes, of course, right? Can we show the video? Is it possible? Can we show the video? Can we show the video? Need? Okay, we will show it then later. I'm sorry. This time we didn't. It didn't work out to the level. But you will get the video. So don't worry. So then you'll see what we are going to do afterwards. What we did also in the evenings. Okay. Wonderful. Thanks very much to everybody and everybody here.
Bye, everyone. Bye.
Applaus to Eugenia.
Bye, everyone.